Hello, welcome again. Join me as I dive into the challenge of proving why nurses really need psychology to connect with their patients and, of course, their clients on a whole new level. You're welcome. And in this video, we will be discussing the importance of psychology in nursing and, of course, how it can enhance productivity, how it can enhance efficiency, and, of course, how it can enhance the way the nurses understand and interact with their patient as an holistic being. You understand? Not only being concerned with the physical care. Many challenges we face in connecting with the patient, most of that is due to our lack of understanding the patient's psychological needs and emotional state. You understand? When you understand it too, you'll be able to care for this patient, not only physically, but in all aspects of life. And of course, this lack of understanding can lead to feelings of frustration and burnout among nurses as they struggle to provide empathetic care to their patient. You understand? So there is need for all to have psychology in the palms of inscribed in the palms of our hands. Patients, on the other hand, if we don't know psychology, may feel like their emotional needs have been neglected. And of course, if they feel like that, it can lead to mistrust and, of course, dissatisfaction with their care. And if this happens, as a result, the nurse-patient relationship that is supposed to be there should be a connection between the both of us, can suffer, and of course, patient outcome may be negatively impacted. On the other way around, if we understand, the patient outcome should be positively impacted. And furthermore, without a deep understanding of psychology, we as nurses may unintentionally perpetuate harmful stereotypes, you understand, or biases against this patient, which can further exacerbate or aggravate their existing health conditions. You understand? Moreover, the lack of psychological insight for nurses can, of course, make it more difficult for our nurses to identify. There are some things that we should identify. The underlying causes of patients' behavior. You understand? Leading to, when there are some things that you should learn, leading to ineffective intervention. If you don't understand the underlying behavior, you might not be able to plan a standard nursing care plan and intervene on this patient care. And of course, leading to mismanagement of care. It will lead to mismanagement of care. So there is need for us to know the nitty-gritty of what we call psychology when we're talking about that. And in this video, we will be exploring the key psychological concept which can help us empathize better with our patient and clients. And when we're talking about that includes emotional intelligence, good and efficient communication skills, you understand? And of course, the impact of mental health on the physical health of the patient. Then we are not going to nurse them because this one came to the hospital with burnt injury. That's what I want to treat. For example, emotional intelligence enables nurses to be able to recognize and regulate their own emotions. You understand? You'll be able, when you are emotionally intelligent as a nurse, you'll be able to regulate your own emotion and patient's emotion, and as well create a more empathetic and supportive care for the patient. And you'll be able to provide a therapeutic environment for the patient. On the other hand, when we're talking about effective communication skill, Of course, this can help nurses to convey empathy and understanding to their patient. And of course, just that small thing is critical in building trust and fostering a collaborative relationship between the patient and, of course, the client and the nurses. So, by understanding the interplay between the mental and the physical health, simply nurses can go places, and it can assist us in developing more comprehensive, clear plan in this day of nursing diagnosis, the intervention, the assessment that can address the patient as a whole. That is what we call holistic care, rather than just their physical symptoms. Somebody came down with malaria rather than the physical symptoms. And of course, when we're talking about emotional, about psychology, additionally, nurses can learn to recognize the symptoms and the signs of mental health issues. If you don't understand psychology, you might not be able to see all those things, such as depression or anxiety. Patient is anxious because he's a married man, he's at home, he has left his wife, he has left his job. So you should be able to care and provide appropriate referrals and support when the need arises. So when you are able to integrate as a nurse the psychological concept into our practice, then it becomes easy for us as nurses to be able to provide more patient-centered care that addresses the unique needs. That's the goal and experiences of each individual, and that is the key. Then when we're talking about going further reiterating, the key inside here is that integrating psychological principle into nursing practice will not only benefit patient, it is not only benefiting patient outcome, but also foster a healing, and therapeutic environment for the patient. That is what it does. When you as a nurse, you understand the psychological, nuances of your patient. It builds their self-esteem. It creates a care-centered environment. A care environment that is tailored specifically to meet individual needs. And when it does, thereby promoting feeling of safety, comfort, and of course trust, which in turn, when you look at it, can of course lead to better outcomes positively. The patient gets discharged, patient goes home, and of course increases their satisfaction, improves their mental outlook, increases their self-confidence, their self-esteem, and they feel that they have been well taken care of. And I also want you to know that a psychologically informed approach to care can also benefit us as nurses. You understand? Number one, it reduces the feeling of burnout. It reduces the feeling of compassion fatigue. There's something we call compassion fatigue. You are just tired. And of course, increases job satisfaction and engagement. Because when you want to diagnose the patient and you have been able, just by history or just observation, you have been able to get 50% of what you need. The 50 is good. By recognizing the critical role of psychology in nursing, we can create a health system that truly prioritizes the well-being of both the patient and we, the care provider. In essence, psychology is not just a nice to have, but of a must have. A must have so that we can deliver high quality, patient-centered care. It is very, very vital, integrating the patient into, an holistic system. So the integration of psychology into nursing practice is also has a profound impact on healthcare. You understand? At times it reduces the stay of the patient in the hospital. For instance, there is a study that showed that patients who we are able to listen to and we understand their healthcare their health issues, it is easy for them to adhere to their treatment plan. And when it does, lessen the burden, because there will be better outcome, and the burden and on us with the carer are reduced, and of course there will be reduction in their own complications. Moreover, a psychologically informed approach care can help us to address health disparity by recognizing the unique, the cultural, the economic context that shape the patient experiences and of course behavior. So by this, you acknowledge the centrality of psychology in nursing. It is very, very vital to acknowledge that in nursing, so that we can move from beyond a solely biomedical model of care and towards, there are a lot of theories that were propended by some nursing theories, Virginia Anderson, the Orem theory, Dorothy Pepler. We have a whole lot of them. So you have to incorporate all these things to be able to get the best for our patient. In summary, psychology is an essential tool for nurses because of what? It can lead to better patient care, you understand, and stronger nurse-patient relationships. And that is the best. And of course, by recognizing the importance of psychology in nursing, we can create a healthcare system that truly prioritizes both the well-being of patients and of course the nurses. If you found this video insightful, be sure to check out our next video. I'm your friend Nurse Toke. The next video is going to be on effective communication strategies in nursing. Let me know in the comment what your thoughts are in this video, or you comment, or you like, or you share, or kindly subscribe to our channel. Thank you, and do have a nice day.